Okay, so major arteries, you don't really need me for this. You just kind of have to sit down and memorize this. But I'll go through it for you. So let me change colors here. Too much red. Whoops, sorry. Let's go to blue. Perfect. Oh, I don't know if blue's a good one either. Let's go to yellow. All right. So, from the left ventricle, right here, blood will come out the aorta. It goes over the arch of the aorta, sorry, and down behind the heart, posterior to the heart. So that's the thoracic descending aorta, and then this would be the abdominal aorta right here. Once the blood comes through here, it splits into the left and right common iliac arteries. Common iliac, sorry. From the common iliac arteries, that's going to branch into the external iliac artery. Okay, external, and then the internal iliac. So the external iliac continues over the inguinal ring here, the inguinal ligament, that's this ligament right here. Once it passes over that, now it's called the femoral artery. Remember, as soon as these vessels pass a major landmark, they change their name. So between here and here, it's the femoral artery. Then that's going to branch into the popliteal artery right here, which goes posteriorly. And then down here, we're going to get a branch anterior and posterior tibial arteries, and then the arcuate. Later on, we're going to see the different, an arm and a leg by itself, and we'll have more. So, on the arch of the aorta, so we need to supply the right arm, the left arm, and the brain. So the right arm starts with this brachiocephalic trunk. That will branch into the right subclavian and the right internal carotid. On the middle branch, the second branching off of the aorta will be the left internal or common carotid, left common carotid coming up here, and then the left subclavian going out to the arm. So you can see the arms and legs better on a closer picture. But what I want to point out, because where'd this go? Let me point this out. So as the aorta comes out, down, and around, it has these three large branches. Number one is brachiocephalic. Number two is this the right common carotid, external carotid. And then the last one is the left subclavian. This is left subclavian, because this will branch into right subclavian. Okay, and then off of the left subclavian you'll get the left internal carotid. Actually, it's the common carotid, which will then split into the internal and external carotid. But let's go. So the ascending aorta rises from the left ventricle. It'll branch into the coronary arteries first. So the very first arteries that come off, as you know, are the left and right coronary arteries. Now, as we get up to the aortic arch, which is posterior to the manubrium, right, of course, it's higher than you think in your chest. So number one, as we said, brachiocephalic trunk, left common carotid, and left subclavian. So here's what it looks like. Again, here's the arch. Here's your right coronary. Here's your left coronary. These always come off right after the aorta, the blood is ejected from the left ventricle into the aorta, these two coronary arteries come off. Right coronary, left coronary. So then the blood will come up, and the first one is the brachiocephalic trunk, which is just this part. Okay? The first branch that comes off of the brachiocephalic will be the right common carotid artery. Right here. Okay? Then this changes its name now. It's going to be the right subclavian. So brachiocephalic will branch into the right common carotid and the right subclavian artery. The next one will be the left common carotid. Left common carotid. And the carotid arteries go up your neck, and that'll split between your face and your brain. And the third one will be the left subclavian. Subclavian because it's deep to the clavicle. Clavicle would be right here. Okay? Clavicle over here as well. So you know the rest of these. Thoracic aorta, you know all of these. So then the descending aorta continues after the aortic arch, and now it's called the thoracic aorta in the region of T5 to T12. Once it passes the diaphragm, it's going to go down to approximately L4, and that'll divide into the left and right common iliac arteries. So let's look at the head. So here's our brachiocephalic trunk here coming off of the aortic arch. Here's our common carotid right here. It's only a short distance. Here's our right subclavian. It's right subclavian. And then that, as soon as it crosses over the first rib, now it's called the axillary artery. Now it'll be in the area of your underarm or your axilla. So let's follow our common carotid artery up here. Right? Now it's going to branch into the external and the internal carotids. So the external is going to come up here, and this is the temporal artery, superficial temporal artery. So this is where you're going to get those headaches in your temples, right? And then you have the posterior auricular, which means behind the ear. Pretty easy. And then the one that comes to your upper jaw, that's the maxillary artery. And then the one that goes behind, around the occiput, that'll be the occipital artery. And then this one coming up the face here, this will be the lingual artery. And this comes off the external carotid. So the external carotid kind of, let me just show you here. External carotid feeds the face. The internal carotid, brain. So the internal carotid is in here, and we'll take a look at that on another slide. Okay. So we're looking at the base of the brain here. So the carotid arteries, here's the internal carotid, comes in right here and right here, the left and the right. And it's going to anastomose with the two, remember those vertebral arteries coming up the transverse foramen on the cervical vertebrae? Well, here we meet them again. So now they're going to supply, here's the medulla, right? So these are going to join, the left and right vertebral arteries will join to form the basilar artery. The basilar artery will have a lot of tributaries coming off of it. You don't need to know any of these. Remember, these are feeding the pons. Yes. Then you'll have a major branch which goes laterally left and right, and these are going to be the posterior cerebral arteries, left and right. And then we're going to go into the posterior communicating arteries here. Okay, and these will anastomose with the middle cerebral arteries, middle cerebral, right? And then the anterior cerebral is just this loop right here. Okay, kind of simple. It makes this cerebral arterial circle. It used to be called the circle of Willis. Okay. So it's not that bad. It's the vertebral arteries joining to form the basilar artery, the posterior cerebral, the anterior cerebral, and the anterior communicating. That's all. And the middle cerebral is fed by the internal carotids. So the internal carotids basically anastomose with the vertebral arteries down here. And there's double blood supply to all of these structures, as it should be. So, upper limb, here we go. Here's the aorta, here's the right, or sorry, the brachiocephalic trunk, right? Here's the right internal common carotid, common carotid. Here's the right subclavian. Once it passes over here, now it's the axillary artery. Axillary. Then these always have an anterior circumflex artery. Anterior circumflex. And then as it comes down and passes, I don't know, mid-shaft or something. Well, actually, I think the axillary changes names when it comes out of the axilla. Now it's called the brachial. It's right here. I'm sorry. So the axillary would be between here and here. Then this will branch right here. The anterior one would be the brachial artery, and the posterior one is just called the deep artery of the arm. And that will come this way, posterior to the humerus, wrap around, and anastomose with the common interosseous. So this is brachial here. Then we have the radial and the ulnar. Radial on the radial side, ulnar on the ulnar side. Then we have a superficial palmar arch where these two anastomose. And then a deep palmar arch where again they anastomose. And then these out here are called the digitals. So that's not too hard. There will be on each level of the ribs one little artery, and these are called posterior intercostal arteries. Then from the right subclavian and the left subclavian, you'll have one branch coming down the anterior rib cage. These will be the internal thoracic arteries. And then another one out farther, and that'll be the lateral thoracic artery. And here's your descending aorta. So, arteries of the abdominal aorta. The first one after the diaphragm is called the inferior phrenic arteries. And these feed the diaphragm. And that makes sense, right? Phrenic. The phrenic nerve innervates the diaphragm, and the phrenic arteries bring blood to the diaphragm. So the celiac trunk, this is the first trunk coming off the abdominal aorta. And a trunk means that there are branches coming from it. Okay, and we'll talk about those in a moment. So celiac trunk, superior mesenteric arteries, suprarenal arteries, those would be the adrenal glands. The renal arteries going to the kidneys. So this goes to the kidneys, these go to adrenals. The mesenterics goes to the intestines. The celiac trunk goes to spleen, stomach, liver. The gonadal arteries go to the gonads. The inferior mesenteric goes to the second half of the large intestine. and the sigmoid colon and the lower intestines. And then you have the common iliac arteries, which go into the legs. Okay, here's what it looks like. Here's the diaphragm. This is where the inferior vena cava will go. Assemble it up this way. Your liver goes like this. So here's your celiac trunk right here. Okay? So that's the first one. The second one is superior mesenteric. Then you have the suprarenals. Suprarenals. Superior mesenteric. These are the gonadals right here. Inferior mesenteric. And then the common iliacs. Okay? And right down here we have the median sacral. So pretty simple. Oh, sorry, and the renal arteries going to the kidneys. These are the biggest ones. Okay. And then your spleen lies up here. So one of these will go up here, and this will also supply the pancreas, which is here, the stomach, which is here, and we'll look at all of these. So we're going to look at the celiac trunk and its main branches. So it has these two that go left and right, and then one goes superior. The one that goes superior is called the left gastric artery. Okay. This is going to feed the lesser curvature of the stomach. And then a left huge artery, which is the splenic artery, and this is going to go all the way over to the spleen here. Right? And then the right one is called the common hepatic artery. That's going to go to the liver. Hepatic is liver. So hepatic, splenic left, hepatic right, and then up here is the left gastric. So those are three main branches off of the celiac trunk. If we follow the common hepatic around, that'll branch, and now it's the hepatic artery proper. That's here. This will branch. So the common hepatic artery will branch right here into the right gastric. Now if you notice, the right gastric will anastomose with the left gastric. The other one is the gastroduodenal artery. This goes to the duodenum. The duodenum, which is right here. This is the duodenum right here. Okay. It's just the first part of the small intestine. What else do we have? Off of the off of the splenic artery is this left gastroepiploic artery here. Okay. And then the superior mesenteric down here. If we lift up the transverse colon and look on, take a look under its skirt, here's the superior mesenteric artery. This is distribution of the superior and inferior mesenteric arteries. You don't have to know any of this. This is the superior mesenteric artery, this is the inferior mesenteric artery, and all of this jazz is the mesenteries. All of these and all of this tissue here, this is called the mesenteries. You don't need to know any of these arteries, just the superior and inferior mesenteric. So arteries of the pelvis, once we get to the internal iliacs, so here's your aorta here. Here are the left and right common iliac arteries. So then those will go into internal and external iliacs, and then the external iliac will go into the femoral, the popliteal, the anterior and posterior tibial. This is not too difficult. So here's the right common iliac. Here's the external. This is the internal. That's all you need to know. You don't need to know the gluteal arteries. You don't need to know the obturator. You don't need to know any of those, or these, or these, or these. All you need to know is the common iliac, the external, and internal. That's it. Okay, once we get here, now we're going to go into the leg. Here's your common iliac, right here. Then the internal iliac goes into the pelvis, and the external will go out to feed the leg. Once it crosses here, now it's going to be called the femoral artery. Right? So this is all the femoral artery. Then you're going to have a lateral branch out here. This will be the deep artery of the thigh. And then, of course, you have your circumflex. Each joint has a circumflex. That's this one right here. So this is the deep artery of the leg. This is the femoral artery of the leg. And then, remember, we learned that word popliteal. That's going to be this posterior branch here. Right? And then we have anterior and posterior tibials. And then the fibular is one small artery down here. And then dorsalis pedis, this is where you can take a pulse right down here. It's on top of your foot on the medial side. Instead of a palmar artery, we have an arcuate artery, and then the medial plantar artery. So this is the arcuate. The plantar artery is on the medial side of your foot, and it goes underneath right there. So if we take a posterior view of the leg, the popliteal artery goes just posterior to the knee, and then I'm trying to figure out which is medial and which is lateral. So this is lateral here. This is medial over here. So lateral we have anterior tibial, although this should be fibular. Yeah, this is the fibia here. So this is the fibular artery. This is the posterior tibial artery. And this is the anterior tibial. So the popliteal will split, branching here, into the posterior tibial and fibular arteries. And then the anterior tibial goes through this. There's a hiatus here between the tibia and fibula, and this will move anteriorwards. And then again, the lateral plantar artery here, medial plantar, and then the dorsalis pedis here, and then the plantar arch. And these down here would be the digitals. And not too bad. Here's a great chart that I put in your notes. These are the general arteries that you should know. So here's the diaphragm here. All right. So here's the celiac trunk. This is what it feeds. Here are the superior mesenteric arteries, what they feed, the suprarenal glands, and the kidneys, and the gonadals. Inferior fronix, the diaphragm, the lumbars, posterior wall, median sacral, sacrum and coccyx, and then the common iliacs. Above the diaphragm, we have the mediastinal. You don't need to know that. You don't need to know that. Don't need to know that. Pericardial, it's obvious. Don't need to know that. I don't care that you know these. I don't care that you know those. I do care that you know all of these. So as the aorta comes out of the heart, left and right coronary arteries, those are first, right? Here's the heart, left ventricle. So the first one, brachiocephalic, turns into the right subclavian, axillary, and then brachial, radial, ulnar, etc. So this chart tells you what is supplied by these major arteries. So this is what is supplied by these major arteries. Okay. So the veins. Now the veins come from the capillary beds. They will join up and they'll form major veins. We have three major veins that enter the right atrium, right? The superior and inferior, and then the coronary sinus. So the superficial veins, we have superficial veins and we have deep veins. Superficial veins are the ones that you can see on the back of your hands and on the front of your anterior arms where they take blood. You see your veins. Especially when you work out, the blood pressure rises and you can see the veins quite easily. We have multi-vein bundles. Those are venous plexuses. We have unusual patterns of venous drainage. We have dural sinuses. Those are in the brain. And we have this hepatic portal system. And a portal system is simply where one vein will go through a capillary system and go into another vein in a capillary system. That's what a portal system is. And we have one in the hepatic portal system, that's your liver, and then we have another one in the pituitary. So here are the vena cava and the tributaries. I guess we'll start from the heart. Vena cava and that tributaries. Superior vena cava, you need to know that it returns blood from the body regions superior to the diaphragm. The inferior vena cava returns blood from body regions inferior to the diaphragm. So, as you know, they both join the right atrium. So here's a great picture. Here's, let me pick another color here. Good. So here's your diaphragm right here. Here's your celiac trunk right here. Here's your inferior vena cava. That's going to go through the liver. Here's your phrenic right here. Here's your hepatic vein right here. Here are your left and right renal veins. Okay. Here's the inferior vena cava, and here are your common iliac veins. The arteries will be deep to the veins. This is the aorta here, and this is the vein here, vena cava here. Look at that. Note the difference in the color, and then the veins are flat because they don't have the muscular wall or the elastic wall that the arteries have. Here are your psoas major muscles. Okay. So major veins of the systemic circulation. Majors. So we have left and right subclavians draining the arms. We have the external and internal jugular veins from the brain. We have the dural sinuses from the brain. We have the vertebral vein going along with the vertebral arteries in the cervical vertebrae. So internal jugular. So internal and external jugular. What happened to my pen? Oh, sorry. Weird. My internal and external jugulars. One from the face, that's the external, and then the internal from the circle of Willis. Then we have our vena cava, axillaries. They're same names as the arteries. There's the brachiocephalic. Then we have the superficial ones from the arms are called the cephalic vein and the brachial vein. So I want you to know those, and I want you to know the basilic vein. Okay. Arms and legs. Okay, let's move down to the... So the dural sinuses, these drain the brain, basically. So what I want you to know here, remember the jugular foramen in the base of the skull? It's the internal jugular that drains all of these dural sinuses. That's all I want you to know. Don't need to know any of those. Okay, so internal and external jugulars, superficial temporal, all of these are going to drain back down to the internal and the external jugulars, right? These are the jugulars here, and they're going to drain into the brachiocephalic. And then the subclavian is coming from the right arm here. Those are going to come back, and they're all going to go into the superior vena cava. Pretty simple. The deep veins follow the paths of the companion arteries and are named exactly the same. The superficial veins, these are the ones that you can see, and they have different names. So the ones in your arms are cephalic and basilic, and then the median cubital, and the median vein of the forearm. So that's all you need to know. You can see these. This is on the ulnar side, the cephalic vein. The one on the deeper one is the radial. We have the palmar arch again, superficial palmar venal arch. So here's the median vein of the forearm, the basilic vein on the ulnar side, and then the ulnars. The ulnars and the radials are deeper than the basilic and the median. Okay? Then the median cubital, remember this is the cubital fossa. So then you have the cephalic vein on the lateral side right here, and the basilic vein on the medial side right here. then the axillary, and then you know those. The antecubital is right there. That's where they take blood. Veins of the thorax, they just follow the arteries. You don't need to know them. Veins of the abdomen, they're exactly the same as the arteries, so you don't need to know those. I'm not going to ask you any of these. So the hepatic portal system, this is very special. Not that it's special, but it's different. I have to find out where my pen is here. It's very different than anything else. So we have our intestines down here. We'll just say we have small intestine down here. What happens is a capillary bed will pick up the nutrients from this and it'll take it over to, so now it's entering a capillary system and it's going to the liver in another capillary system. So what a portal system is, I'll tell you. A portal system is capillary bed to a vein to another capillary bed before, oops, sorry, to another capillary bed before it returns to the heart. So it's capillary bed to capillary bed, then to the heart. That makes sense? So you have capillary beds in the intestines which will pull nutrients from the food that you eat, right? And that's going to be venous. So the hepatic portal vein has taken capillary blood in a vein and not returning it to the heart, and instead taking it to the liver to process all the food. So basically you're taking crude oil from here and you're making high octane out of it. Then that will be returned to the inferior vena cava, then go to the heart. That's what a portal system is. So here's the stomach and intestines. You have, this is your, okay, this is the arterial blood. This is your intestines. The first capillary bed will pick up food. Here's a food molecule. That will be transported in the hepatic portal vein. So we're going to a vein, and normally every other vein will go back to the vena cava to the heart, but instead the liver's in the way. So that's what a portal system is. Two capillary beds, capillary bed to capillary bed instead of capillary bed to heart. Okay? Very simple. So while this venous blood is in the liver, it's delivering all the nutrients from here to be then modified so that your body can digest these foods, not digest them, but utilize them. So if this was an amino acid, say, it'll go to the liver and it'll be modified, so now when it goes back to the heart and then into the arterial system, it will be more suitable for cellular ingestion. I hope that's clear. If not, you email me and ask me. So again, here are the veins of the hepatic portal system. So these mesenteries, these mesenteric capillaries, are going to take the blood up the hepatic portal vein into the liver, gets processed, and then it's going to be delivered back into the inferior vena cava and returned to the heart. It's not that difficult. So the veins of the lower limbs, here we go. Simple metatarsal veins, dorsal venous arch, dorsalis pedis vein, anterior tibial, fibular, popliteal, great saphenous, you've heard of saphenous, the femoral vein, the deep femoral vein, and into the external iliac, internal iliac, common iliac. But see, these are larger, so they're named for the arteries that they accompany. Okay, so you just have to know these and these. And here's just a little closer picture of it. And here, these are the structures that are drained by the particular vein. So if I say left common iliac, it drains the pelvis and the lower limb. So if I ask you on a test, what part of the body does the left common iliac vein drain? You will say pelvis and lower limb. If I ask you, what does the inferior vena cava drain? You'll say anything below the diaphragm. Here's the diaphragm. Got it? So the right internal jugular drains the brain. Okay? So here are the disorders. Not too difficult. Aneurysm is a ballooning out of a major artery. That's because the artery walls have weakened, and now an artery that should look like that now will look like that, which makes this part of the wall weaker, and it could rip, and blood will come out and you'll die. A deep vein thrombosis. We have the deeper set of veins, and this usually happens in the legs. These can form clots because you're not moving around very much. This happens in bedridden people, although there is a hereditary component. I had a friend who in his 40s got these deep vein thromboses, and you need treatment for this right away or it can kill you. Because in the legs you have these compartments, and if you have leaking of the veins in these compartments, it'll constrict and stop the blood flow to your legs, or a clot can form in your leg, break off, go to your heart, the pulmonary trunk, and then you die that way. So then we have venous disease, which is simply inadequate drainage of venous blood from the limbs. Tissues become ischemic. That means they don't have any blood. So then they're vulnerable to death and damage and ulceration. This is failure of the valves. You know, remember in the legs you have all of these valves that go this way. So if the blood pools here and the veins pull apart, right, then it's going to go down to the next check valve, and that just causes a lot of trouble. So then we have arteriovenous malformation. This is a congenital condition, so you can't catch it. You're born with it. So this is a condition in which the capillaries fail to develop in a certain location so that an artery continues directly to a vein. Artery, vein. The high pressure entering the vein causes an aneurysm. So now the vein is going to cause an aneurysm, which can compress nearby tissues, or it can break and cause a stroke. These happen in the brain. Then atherosclerosis you're familiar with. You eat too much fat. The arterial wall becomes thick and stiff and causes inflammation. And then LDL is attracted and you get plaque, and then it eventually will build up and blood can't get through and you have a heart attack. This happens in the coronary arteries. Then you have microangiopathy of diabetes. Diabetes causes a lot of complications. The elevated blood sugar leads to deposit of glycoproteins on the basement membrane of capillaries, and it diminishes the efficiency of the capillary. So organs most vulnerable are the kidneys, the retina, you've heard of things like this, and the peripheral nerves and the feet. That's called diabetic neuropathy. Okay? And that's that.